If you are a female in middle age, post-pregnancy or perimenopausal and suffering from roomy and lax vagina and looking for the perfect treatment and still confused whether laser will work for you or should you opt for a surgical tightening, then I hope this video may help you. Laser vaginal tightening is very commonly used as an outpatient procedure, have become increasingly popular for cosmetic reasons, for enhancement of sexual functioning and to treat vaginal laxity. This process of vaginal tightening with a laser does not exceed more than 10 minutes and it's painless, the best part of it is, and it is performed in 3 to 4 sessions with a gap of 4 to 6 weeks between each session. Laser acts by narrowing the vaginal wall, that is mostly the vaginal mucosa, hence enhances sexual pleasure. Laser helps in shrinking the vaginal mucosa but has no effect on the underlying or the deeper muscles. Now let's see what are the complications or the sequelae of laser vaginal rejuvenation. That may include redness, infection, bruising, bleeding and sometimes numbness, but this typically fade as the area heals. And the long-term sequelae or side effects may include a serious infections, premature death of tissues and pain during sexual intercourse. It can lead to permanent loss of sensations in the vaginal area. Further, laser only affects on the lumen of the vagina. It has no role on the vaginal opening or the vaginal orifice. It still remains lax. On the other hand, the surgical tightening of the vagina is just a day-care procedure. You come in the morning and leave in the evening. Here we remove the excess lac mucosa, tighten the muscle in 2 layers, and plication of the muscle as well as the mucosa is done. Any grade of vaginal laxity, how much lax the vagina is, can be treated by surgical vaginal tightening. The suture used are dissolvable and dissolve in 4 to 6 weeks time. The best part is we can narrow the vaginal opening as well as we tighten the muscles as a part of the perineorrhaphy procedure. So apart from V-tightening and perineorrhaphy, we can trim the hypertrophied labia minora if required as a part of designer vaginal creation. So for more queries regarding V-tightening, perineorrhaphy or labia trimming, you may connect with us at Kalosa Aesthetics. We'll be happy to help you. Thank you.